The COVID-19 pandemic tested the very fabric of our nation's healthcare system. Hospitals were overwhelmed and healthcare workers faced unprecedented challenges. The virus spread rapidly, causing a global health crisis that affected every aspect of our lives. As we slowly emerge from the shadow of the pandemic, we are faced with a new set of challenges. Communities are trying to rebuild and businesses are reopening, but the scars of the pandemic remain. The road to recovery is long and complex. The CDC's decision to retract $11.4 billion in COVID-19 funding has sent shockwaves across the country. This funding was crucial for ongoing research, testing and vaccination efforts. The cut has left many wondering about the future of public health in America. This decision has reignited the debate over public health priorities and the role of government funding in times of crisis. Public health officials and policymakers are now at odds trying to balance budget constraints with the need to protect public health. The impact of this decision will be felt most acutely at the local level. Community health clinics and local health departments, which rely heavily on federal funding, are now facing significant challenges. These institutions are the front line of our public health system. State and local health departments are now grappling with the loss of vital resources. Budget cuts mean fewer staff, reduced services and limited access to essential medical supplies. The strain on these departments is immense. This funding cut comes at a time when our nation is still grappling with the long-term effects of the pandemic. Long COVID remains a significant concern, with millions of Americans experiencing ongoing symptoms and health issues. The virus continues to circulate and new variants pose a constant threat. Ongoing testing and research are essential to stay ahead of these variants and prevent further outbreaks. Millions of Americans are living with long COVID. These individuals require ongoing medical care and support, adding to the burden on our healthcare system. Our healthcare workers are exhausted and our healthcare system is strained. The pandemic has taken a toll on the mental and physical health of our medical professionals who have been on the front lines since day one. This decision has raised serious concerns about our nation's preparedness for future health emergencies. Without adequate funding and resources, we risk being unprepared for the next crisis. The lessons learned from COVID-19 must guide our future actions. It is important to remember that the COVID-19 pandemic is far from over. While the daily death toll has thankfully diminished, hundreds of Americans are still succumbing to this virus every week. We have lost over 1.2 million lives in the US alone, a grim reminder of the virus's devastating power. The long-term health effects of COVID-19, collectively known as long COVID, are only beginning to be understood. Millions are struggling with debilitating symptoms like brain fog, fatigue, and respiratory issues. These individuals require ongoing medical care and support, placing an additional burden on our already strained healthcare system. The pandemic has also exacerbated existing health disparities. Communities of color, already disproportionately affected by the virus, now face greater barriers to accessing quality healthcare. The Department of Health and Human Services, HHS, argues that the $11.4 billion in COVID-19 funding is no longer necessary. They assert that the situation has evolved significantly since the height of the pandemic, and the funds could be better utilized in other areas of public health. They claim that the pandemic is over and that these funds are needed elsewhere. According to HHS, the nation has moved past the emergency phase, and it is time to redirect resources to more pressing health issues. HHS has indicated that it will prioritize funding for chronic diseases and initiatives aligned with the Trump administration's Make America Healthy Again agenda. This includes focusing on long-term health challenges such as diabetes, heart disease, and mental health services. However, critics argue that this decision reflects a short-sighted view of public health. They believe that the pandemic's impact is far from over and that the reallocation of funds could leave the nation vulnerable to future health crises. They contend that declaring the pandemic over ignores the reality of long COVID and the potential for new variants to emerge. Long COVID continues to affect many individuals, and ongoing research is crucial to understanding and mitigating its impact. The lack of transparency surrounding the reallocation of funds has also fueled skepticism. Critics demand clear communication and accountability regarding how these funds will be used and whether they will truly benefit public health. Many question whether these funds will truly be used to address pressing health needs or if they will be diverted to other priorities. The debate continues as the public and health experts call for a balanced approach that ensures preparedness for future health emergencies while addressing current health challenges. The HHS has provided limited details about how the $11.4 billion in retracted funds will be reallocated. They have mentioned a focus on chronic diseases, but specifics remain elusive. This lack of transparency has fueled speculation and concern. Some fear that these funds will be used to advance a political agenda rather than address critical public health needs. Others worry that the money will be directed to large national organizations at the expense of smaller, community-based groups that are often better equipped to reach vulnerable populations. The absence of a clear and detailed plan for reallocating these funds raises serious questions about the HHS's commitment to transparency and accountability. Section 5, Ground Zero, the local impact. The impact of the CDC's funding retraction will be felt most acutely at the local level. Communities that depend on these funds for essential health services are now facing an uncertain future. State and local health departments, already operating on shoestring budgets, are now facing devastating cuts. These cuts threaten to undermine the very foundation of public health infrastructure that communities rely on. These departments rely heavily on federal funding to support vital programs, including testing, vaccination, contact tracing, and data analysis. Without this support, the ability to manage and prevent disease outbreaks is severely compromised. In Denton County, Texas, 6 crucial positions in nursing, community health, and epidemiology are at risk due to the funding cuts. These roles are essential for maintaining the health and safety of the community. Director Matt Richardson is desperately seeking alternative funding sources to preserve these essential roles. He emphasizes the importance of these positions in managing public health crises and ensuring community well-being. Similarly, Dallas County is grappling with the loss of 2 grants that supported lab capacity, epidemiology, and immunization efforts. The absence of these funds could lead to significant gaps in public health services. Dr. Philip Huang, Director of Dallas County Health and Human Services, expressed deep concern about the impact on childhood vaccinations. He fears that the reduction in funding will hinder their ability to protect children from preventable diseases and the county's ability to respond effectively to outbreaks like the recent measles outbreak in neighboring areas. The potential for increased disease transmission is a serious threat that cannot be ignored. Section 6. A ripple effect: consequences for smaller health departments. Smaller health departments, particularly those in rural and underserved communities, are bracing for the most severe consequences. These departments often lack the staff and resources to absorb such significant funding cuts. They rely heavily on federal grants to maintain even basic public health services. The loss of this funding could result in staff layoffs, program closures, and reduced access to essential healthcare services in these communities. This could have a devastating impact on already vulnerable populations who rely on these services. It could also hinder the ability of these departments to respond effectively to future health emergencies, putting entire communities at risk. Section 7. Beyond COVID-19. The broader public health implications. The CDC's decision to retract COVID-19 funding has far-reaching implications that extend beyond the immediate impact on the pandemic response. This decision sends a chilling message about our nation's commitment to public health. It undermines the infrastructure and workforce that are essential for responding to not only pandemics, but a wide range of public health threats. The recent measles outbreak in West Texas, New Mexico, and Oklahoma serves as a stark reminder of the importance of robust public health infrastructure. Measles, a highly contagious and potentially deadly disease, was declared eliminated in the United States in the year 2000. However, declining vaccination rates and the weakening of public health systems have created an environment where outbreaks can easily take hold. Section 8. The search for solutions, a call to action. The CDC's funding retraction underscores the urgent need for a national conversation about public health funding. We need to move beyond crisis-driven responses and invest in a robust and sustainable public health system. This requires a multi-pronged approach. First, we need to increase federal funding for public health infrastructure and workforce development. Second, we need to explore innovative funding mechanisms such as public-private partnerships and health impact bonds. Third, we need to empower communities to take ownership of their health by supporting community-based health initiatives. Finally, we need to educate the public about the importance of public health and advocate for policies that prioritize the health and well-being of all Americans. Section 9. Conclusion. The CDC's decision to retract $11.4 billion in COVID-19 funding is a stark reminder of the challenges we face in building a healthier and more resilient nation. This decision has the potential to unravel years of progress in public health and leave our communities vulnerable to future health threats. We must act now to reverse this decision and invest in a future where public health is a priority, not an afterthought.